Hello, welcome back to Neurospicy Nursing. Today we're going over infective endocarditis. It's a pretty high stakes cardiac infection that you're going to see in a lot in pediatrics. You can still see it in adults, but you're going to see it a lot in pediatrics. All right, so pathophys. Infective endocarditis is an infection of the endocardial surface, which is usually going to be the valves. Um, it's caused by bacteremia, which a lot of times you're going to see kind of with sepsis. But bacteria in the blood that is normally from a prosthetic valve is a pretty common reason that you see it. Um, some common organisms are Staph A, Strep V, and Enterococci. And then also these little pieces of infection called vegetations can form and then break off, which can cause an emboli, which can obviously lead to a PE, a stroke, or like a DVT type symptoms. And then these damaged valves are going to lead to regurgitation, heart failure, as well as conduction abnormalities. Clinically, there's a pretty classic triad, which is fever, a brand new murmur, as well as positive blood cultures. Um, there is something called peripheral stigmata, which is kind of physical signs that you see in correlation with endocarditis, which include Janeway lesions, Osler nodes, splinter hemorrhages, and Roth spots. Also, we talked about that kind of emboli that you can get, which is flank pain, limb ischemia, strokes. Heart failure can also develop from that valve destruction, and you can see petechiae, night sweats, and weight loss. Treatment is going to be lots of antibiotics. Obviously, the antibiotics are based on cultures. So if you think that someone has endocarditis symptoms, we're obviously going to get cultures. And we're obtaining those blood cultures before we get the antibiotics, unless the patient is completely unstable. Valve surgery. It's going to be indicated if the patient ends up having severe regurgitation that's causing heart failure, persistent bacteremia, large vegetations, or an infection of their prosthetic valve. And we're going to treat any other complications that can be caused by this, like heart failure, arrhythmias, and emboli. Nursing care is going to focus on monitoring for deterioration and complications. Like we're going to monitor their fever trends, murmur changes, and for any signs of an emboli. We are going to also assess for any neurological deficits just because of the risk for stroke. And then we're watching for heart failure signs like crackles, edema, and dyspnea. We're going to make sure that we keep a very strict antibiotic schedule as well, draw serial blood cultures as they're ordered, and we're going to educate family on central line care if we think that long-term IV antibiotic therapy is going to be needed. And we're clustering care just to kind of reduce agitation and irritation. So, parent and patient teaching. I put patient because it can happen kind of at any age. Someone can have a valve repair as a baby and not end up with infective endocarditis immediately. It can happen because let's say the parents go to the dentist, right, and don't inform their dentist that their child has um, a prosthetic valve because they didn't think it's necessary. They can end up with it because of that dental procedure. That's that's why I say parent and patient, because if the patient becomes old enough, they also need to understand, I have this thing. I also need to be letting people know um, that I'm at risk for this. Hopefully that makes sense. But we're stressing the importance of completing the full antibiotic course. Normally they're going to be on IV antibiotics, but if they go home on the IV antibiotics, like in a central line, then, still doing the same thing, completing the full course. We're going to be monitoring for fever, fatigue, new shortness of breath, and any neurologic changes. If they need like endocarditis prophylaxis for anything, like if they have a certain congenital heart defect, if they have a prosthetic valve, or if they've already had endocarditis, then you have to teach them what are the reasons for needing prophylaxis. Like I mentioned, dental is a good one. And we're going to encourage good dental hygiene, makes sense, and then the avoidance of IV drug use, as well as we are continuing to follow up with cardiology if we've already had infective endocarditis, as well as infectious disease if is needed. Oh, and I did forget to mention that if we're explaining to parent and patient that endocarditis is a valve infection and it's going to require long-term antibiotics. All right, these are the resources, and that's all I have for you guys, and that completes everything cardiac for pediatrics. So yeah, look for musculoskeletal and skin. Those are going to be the next topics that we're going over. Thank you guys, and I'll see you in the next ones. Bye.